anesthetist from Amstelland Ziekenhuis. She will be discussing, for the benefit of our listeners, this let's discuss area of medicine and its administration and risk. So, for you to know her a little bit, this is a bit of her bio. 1987 to 1993, she studied medicine at the Free University of Berlin, Germany. And then from 1993 to 1997, she became specialist in anesthesiology and emergency. She studied anesthesiology and the emergency medicine. So 1993 to 1995, she worked in the Department of Anesthesiology in intensive care in Central Clinical Brandenburg in Germany. And then 1996 to 2001, she was in the Department of Anesthesiology and Intensive Care in Frankenhaus, Berlin. That means Ziekenhaus, hospital in Berlin. So in 1993 to 2002, she worked as an emergency doctor of the trauma helicopter in Brandenburg. And then 2000 to 2001, specialized in patients with burns and specialist in intensive care. So 2003 till now, she has been working in Ziekenhaus Amstelland. So, well, listeners, you can agree with me that our guest really is an expert in this field and has had a long experience and is very, very competent to discuss this issue. I mean, no other person can handle this topic better than Dr. Gehlich, who have been very active in the field for at least 24 years. We are very privileged to have her today in the studio. Please call us on the studio line once again on 020-737-1619, or you want to call us off air, you can call 0684-606-550, Voice of Niger. Well, Dr. Beate Gehlich, welcome to Radio Voice of Niger.
Welcome, Mrs. Volcano, and also a warm welcome to all the listeners. I hope it's an interesting point that we can make today to make patients less anxious about anesthesia, and hopefully they will come as patients to see me.
You know, when I was operated upon, and then you came up with this anesthesia you gave me at the West.
Yes.
You know,
yes,
I was trembling. Did you see how I was a little bit scared?
Yes, I know.
But you made me to relax.
That's what most patients are, because luckily for most of the patients, they are undergoing anesthesia not very often.
Yeah.
It's only once or twice that they have to undergo an operation.
Yes.
And if it's a bigger operation then, where two different anesthesiologists may work on the patient, or where different techniques are necessary,
yeah,
then it's always a bit scary for the patient. That's normal. So, but well, part of my job is to make patients lose their fear.
So, doctor, can you please tell us, why did you specialize in this area? What is your passion?
There was a kind of coincidence. Anesthesiology was, when I studied medicine, not a very big topic.
Yeah.
During the study. And I thought, well, it is evident to know things about anesthesiology, and it's also evident to know how to resuscitate patients. That is part of the anesthesiology.
Yeah.
And to know how to deal with really, really sick patients,
yes,
after car accidents, after other accidents, with severe illnesses. So that was the reason why I thought, okay, I have to stay a time in anesthesiology and intensive care.
Okay.
But well, after having started with the specialization, I liked it so much that I'm still in it. So
you like it so much to put people to sleep.
I like it so much.
And then they wake up again.
No, it's more that I really like to make it possible for patients to undergo surgery and all kinds of procedures.
Yeah.
Without or with very less pain.
Okay.
So that's my point. So I want to make it possible that patients can be cured with no pain.
Okay. Now, who is an anesthesiologist? Describe it just with one word or two. So how can we describe your job?
Well, my job is to care for patients.
In the context of a layman's view, how can you explain it? Because we are calling this big name anesthesiologist or anesthesiologist or anesthesia. Tell us in a very simple word, what is it? What is your job?
Well, my job is to care about patients before, during and shortly after operation, or during other diagnostic procedures that may be painful and that need anesthesia.
Anesthesia.
And it's not only that I let people sleep and I wake the people up and I say, okay, my job's over. It's also I see people before the operation to make it very short, safe for the patients. I see people afterwards to prevent them from post-operative pain. So it's more or less care about peri-operatively phase in the hospital.
Well, to those of you who are outside there and you are listening to us, we have Dr. Gehlich. She is an anesthesiologist. She is an anesthesia is somebody who puts who deadens. They give you the injection to deaden the part of you before operation takes place, so that you don't feel any pain. So maybe it's a major operation or a minor operation. There are those specialist doctors who you see in the theater who put you, sometimes they will tell you to count 1 or 2 to know whether you are still alive before the main operation starts. So you can see how important this job is. Now, is there anything else that anesthesiologists do?
Yes, we take care about the patient's circulation. That means the blood flow during the operation. We take care about blood pressure. Blood pressure should not be too low. That's not good for the brain of the patient. We take care about blood loss, that patients will, if necessary, get fluid replacement or get blood replacement if they lose blood during an operation. And well, we also look on the depth of their sleep. So we really care about, are they really sleeping deep enough, or are they sleeping too deep? So we're really looking that everything stays stable during the operation.
So, doctor, would you please tell us, are there some mistakes that take place during that sleep?
If there are mistakes?
Yes. Can somebody sleep that way and then they wake up anymore?
Let me explain the other way around. If you ask patients that has had anesthesia 20, 30 years ago, they may be patients that have experienced some strange thing like, I heard everybody talking during I was operated, or even I felt something during my operation, so I was not really asleep. That was in former times when it was not possible to make the technique of total anesthesia individual for each patient. But nowadays, if you are an elderly patient, if you are a child, if you are, let's say, small, if you are very big, like 150 kilograms or so, we have to adjust the anesthesia to that weight and to your age. And because we do so, it's not very likely that you will not wake up, and it's also not likely that you are not sleeping deep enough. So it is a bit individual anesthesia what we give nowadays.
Okay, so can I be allowed to choose any type of anesthesia I want? Is that what you're trying to say? People choose the type they want. The one that can put them half asleep, or the one that can put them full sleep?
No, I'm just saying, in some cases that's also possible. But what I'm saying is a man that is 80 years old and 60 kilograms will not get the same amount of anesthetic medication than somebody that is 40 years and 150 kilograms. So anesthesia is individually adjusted for each patient, so that it can't happen that somebody will wake up during the operation. So that it also can't happen that somebody will not wake up after the operation. So there are still cases that people are not waking up after having anesthesia. But that's then because it's an emergency operation. It's maybe because there are people that are really seriously ill before undergoing operations.
Okay.
Or people that have diseases that nobody knows before.
Okay.
That also happens. There are, let me give an example, somebody with an abnormal blood vessel in his brain.
Okay.
There are people with abnormalities in their brain.
Yeah.
And yeah, well, if there is a bleeding during an operation, that may cause coma. But nobody could see this before in those patients.
Yeah.
So it's something, nobody knows.
Do you think this sort of thing can take place more in the underdeveloped countries than the Western world? Where to somebody
in some countries, I think so, because there are reasons that those countries can't be so strictly with their regulations before anesthesia, or the regulations before people are allowed to undergo anesthesia and operations. In those countries, sometimes people come from far away to reach a hospital. The operations are sometimes much bigger than here, because people come later, in a later phase of their disease, to the hospital, because hospital is too far away.
Yeah.
Maybe because they have to work hard, maybe because operations are too expensive.
Yeah.
So sometimes the situation of the patient before he actually is in the hospital is worse than here in developed countries. So it can make anesthesia more dangerous for those patients. And also, people don't know so much about their actual health. Yeah. They're not going to a doctor regularly, I think. Yeah. So maybe there is also not the possibility to perform an ECG, that is to check the heart rhythm before the operation. Okay. Maybe there is no possibility to check the blood before the operation. Yeah. That is all things that influence the safety of anesthesia.
So it is always then very important that people check their health condition all the time.
Well, that's truly so, but it's also very important that people are checked before